Our team decided to look at behavioral mental health in South Fulton for the Ideas to Serve competition 2021. Our team consisted of David, Juhi, and Kelsey of GeorgiaTech, and we partnered with Ubuntu Community Catalyst, a local nonprofit who works to co-create a sustainable community impact platform for all community stakeholders. Specifically, we're working with their mental and behavioral health community action team to better understand the problem in a nested system view, and we were tasked with identifying gaps that could be utilized by this nonprofit to maximize the impact of their efforts. The South Fulton community of Atlanta is a vibrant neighborhood consisting of primarily Black and African American residents, a large number of single-parent households, and a low-medium income. To start understanding the importance of behavioral mental health in a community, our team looked more broad to identify certain social determinants that could be used to indicate behavioral mental health, as well as certain barriers to change. Then, looking at South Fulton in particular, we found that the community, though there exists a strong social support network and strong religious identities, has a low socioeconomic status, with median being just $20,000 to $36,000 a year. It has a strong history of experiencing racism, as the community is 66.4% to 80.8% Black or African American, and it is more likely to have adverse childhood experiences, as 33% to 40% of homes are single-parent families. Ubuntu also further identified a poor mental health literacy in the community, as well as negative stigma surrounding mental health. Therefore, there's a lack of awareness for behavioral mental health resources as well as access. Through a survey they conducted, Ubuntu has found the majority of teenagers, adults, and seniors in South Fulton experience adverse mental health symptoms. Mapping out how behavioral mental health affects the community, we found that community members and behavioral health and mental health professionals were most affected, and local and federal institutions could affect the most change. Therefore, by combining this research with their community profile, our team was able to identify gaps where impact could be maximized. Firstly, we found that it is important to have a strong baseline to measure progress in this sector. Secondly, even if there were increased awareness for mental health resources in the community, it would still be a burden on families to pay for support. Ubuntu could look to federal and local grants to provide some relief for families to seek help. Thirdly, we identified a need for support in the form of childcare. Having a place for children to go would open up opportunities for parents to seek help. Lastly, there are several nonprofits in addition to Ubuntu already working in this sector for all of Atlanta. Partnering with them could help increase impact. Thank you for listening, and here are our sources.